What is the requirement of protein in the early stages of pregnancy? The official guidelines for protein requirement during the entire duration of pregnancy is 1.1 gram per kilogram of mother's body weight a day. And this is an estimation. There is very little actual data on the RDA or recommended dietary allowance in pregnancy. There were 2 studies which had actual data. The link to these study papers are at the bottom of the screen. One study was for pregnant women between 11th to 28th week of pregnancy, and the other study was for women in the 16th week of pregnancy. The EAR or estimated average requirement for these ladies was roughly 1.2 grams per kilogram of body weight a day. That means for the 50% of the ladies tested, 1.2 grams per kilogram of body weight was adequate protein. For the remaining 50% of the ladies, this amount 1.2 grams per kilogram of body weight a day itself was not sufficient protein. They started showing hallmarks of protein deficiency or malnutrition. So leave alone this being adequate amount of protein. One of the studies measured the RDA also, and that number was 1.66 grams per kilogram of mother's body weight a day. That means for women who were between 11th to 20th week of pregnancy, 1.66 grams per kilogram of their body weight a day took care of their protein requirement. That was an adequate amount of protein for these women. In other words, between the 11th to 28th week of pregnancy, a woman should consume 1.66 grams per kilogram of her body weight every day. As an example, if the pregnant woman's body weight is 60 kilos, she should consume 100 grams of protein every day. So here are my comments on what is going on. 1.66 grams is the number women need to take below which they will slip into malnutrition or deficiency of protein in the 11th to 20th week of their pregnancy. However, the official guidelines say 1.1 gram and many women must be following that. So what is going on? How are they able to manage this without getting into malnourishment? What happens is, when the protein intake of the body is less than what is needed, the body starts diverting the protein intake only to essential survival mechanisms. And it starts reducing the protein requirement for long-term health issues such as building immunity, such as hair growth. Since the growth of the fetus or putting on protein weight is not considered essential survival necessity, some of that requirement starts getting shortchanged. So it is always a good idea to have 1.66 grams minimum of protein a day to prevent any of this from happening, and it is quite possible that taking more than 1.66 grams could be an optimal amount of protein intake for the best growth of the fetus. To see more videos on this topic, click on the box below in the center. To subscribe to our YouTube channel, click in the circle on the right hand side and click in the box on the left side to see some of our most popular videos. Remember, when it comes to staying healthy, ignorance is not a good option.